Delirium's a common and very serious neuropsychiatric syndrome. Typically, it affects older patients with multiple medical problems. In fact, up to half of all elderly patients in the hospital will have an episode of delirium at some point. But that being said, it can affect anyone, even children, even though that's much less common. So, what is delirium exactly?
Delirium is a state of acute mental confusion. It can be caused by medical conditions or the psychoactive effects of medication or other substances. Unlike the terms encephalopathy and altered mental status, which also describe confusional states, delirium has a clear, reliable definition. As such, it is the preferred term when a patient meets diagnostic criteria. Delirium is a clinical diagnosis. Imaging studies and laboratory tests cannot diagnose delirium itself, but may establish a cause of delirium. Delirium diagnosis requires an acute change in mental status from baseline, characterized by impaired attention, poor awareness of one's surroundings, and often a fluctuating course throughout the day. It also requires evidence of cognitive impairment, such as amnesia, disorientation, disorganized thoughts, delusions, or hallucinations, as well as a medical or substance-induced cause. Delirium is categorized based on psychomotor activity. It can be hypoactive with sluggishness and impoverished thinking, hyperactive with agitation and intense emotions, or mixed-level activity, including combinations of the other two. Delirium is a medical diagnosis, not a mental illness. It can present with depression, anxiety, or psychosis, but these typically improve when delirium resolves. Certain risk factors, such as advanced age or cognitive impairment, may predispose a person to developing delirium. Often, multiple risk factors will be found. Common delirium causes or precipitants include medications, especially anticholinergics and benzodiazepines, urinary tract infection, pneumonia, bacteremia, inflammation after major surgery, decompensated cirrhosis, hyponatremia, and hypoglycemia. Delirium is often preventable. Preventive strategies include avoiding or limiting deliriogenic medications, non-pharmacological interventions for healthy sleep, good nutrition and hydration, correcting hearing and visual impairment, as well as facilitating cognitive and interpersonal stimulation. The primary treatment of delirium involves addressing the underlying cause or causes. Benzodiazepines, which often worsen or prolong delirium, should be avoided except in alcohol withdrawal delirium, and neuroleptics reserved for agitation or distressing psychological symptoms. Delirium tends to improve, in most cases resolve entirely, once its causes are addressed.
Delirium and dementia are two old age disorders. With old age, gradual loss or impairment of cognitive abilities is a natural phenomenon. However, when there are improper and often abnormal changes in thinking and behavior, they may be indicative of an underlying disease or ailment. Delirium and dementia are two ailments that have many similarities and often spoken of in interchangeable manner, though they are separate and different diseases. This article will highlight the differences between delirium and dementia by bringing out their features so as to enable readers to find out what they are their close ones are suffering from.
Meet Frank. Frank is an active, independent gentleman of 71 who is currently living alone. Every morning, Frank's daughter Kate calls in for a coffee and a chat. This morning, however, Frank just isn't himself. He's refusing to eat his breakfast and keeps mumbling about his food being poisoned. After 2 days of this changed behaviour, Frank has been admitted to hospital. He won't answer the medical staff's questions and keeps trying to leave. He is anxious and withdrawn. Kate tries her best to pacify Frank, but he is increasingly agitated. He refuses to eat or drink for staff and has started hallucinating about rats on the ceiling of the room. The doctor informs Kate that Frank has a chest infection, but Kate doesn't think this explains his behaviour. She tells medical staff that her father doesn't normally act like this. The nurse treating Frank believes that Frank's infection may have led to him developing delirium. He explains this to Kate. What were the delirium signs? 1. Frank's behaviour had changed suddenly. 2. His daughter said it was out of the ordinary. 3. Frank had an infection. Frank begins to feel better as his delirium is treated. Medication is given to fight his infection, and Kate helps with his food and drink.
Right now, delirium is associated with a 35 to 40% risk of death in the year after it first presents, but it doesn't have to be this high. With early detection, delirium is preventable and treatable. The important thing is if there is any sudden onset of confusion, please think delirium. We must suspect it, spot it, and stop it.